have a special webinar tonight. We have Dr. Seiden and his wife Ellen here on tonight, and you're going to find out here some really cool stuff as to how light can make such a big difference in people's lives. So I just want to bring you up to date, do a little housekeeping here. So for all those people that stay to the end of this webinar, you'll be entered into a draw. So every time somebody watches it during the month, they get an entry, and at the end of the month, we give away a free Super Palm 1050, and that's the one that has the 660 nanometer wavelength and the 1050 nanometer wavelength. That's a $1,900 value, so please stay with us. And by the way, it's only one entry per person, so don't try and sign up 10 accounts tonight just to increase your ballots. It won't happen. But anyways, we think that tonight's webinar will be very informative. I hope to be able to share with you also the different uses of the light and how we're different from our light to other lights that are out there. So, and why you should look at our light technology. So at this point in time, we're going to probably switch mics here in a minute, but that's okay. We'll do that in a moment when we're ready. And so I'm going to introduce, and I need that panel for. Okay, so I just want to give you a little history of Dr. Seiden. His practice is limited to endodontics. Sorry, I won't get there yet. But you're in New Jersey, and your education, Fairleigh Dickinson University, from 1966 to 1970, Bachelor of Science. Temple University of School of Dentistry from 1970 to 1973, and even more work in endodontics, and that is 1974 and 1977. You have been have a private practice for a number of years, right up to present, and you're assistant clinical professor at Albert Einstein School of Dentistry and International Society of Police Surgeons. And that's to do with your expert witness that you're able to pull in for court cases. And I'm really curious about that. Tell me, so how long have you been doing that?
I've been doing that for probably about 20 years, 20 to 25 years, okay. Doing expert witness for attorneys.
Is that like when you compare like dental fillings to say that this is the person, or how does that?
No, I specialize in endodontics, root canal. So actually, I am on the side of the patient, okay, not on the side of the dentist. So I represent the injured party, you know, the plaintiffs. Nobody wants to represent them, because then other dentists in the area are afraid of you, you know, like they, you know, I become somewhat of the enemy to them, because I'm going after other dentists, but who's going to defend the patient, you know? So somebody has to take care of them.
All right. So, okay. Excellent. So there's just, I mean, if I keep going on your bio, we won't start our program. So,
that's right.
You have a whole bunch of credentials here. And,
I do, and published. I've published, and I lecture all over, and you know, but and I've never had any knock on wood, have never had any complaints filed against me, and I've won every case as an expert witness. So, you know,
this is good. Okay.
So,
well, so what we're going to do is I'm going to let you explain now what has happened. How did you find out about PBM? You know, and how did you get into this for your wife?
Well, I did I was just looking for different modalities. I always look for different ways of helping people, and just through the internet. And randomly, I came across, SunPowerLED, and I started looking at the videos, and I got my first unit, and tried it out, and it worked. There was no question about it. It helped, and I got a great deal of help from Dr. Mel Birchman's video and Dr. Jerry Ross as far
Excellent.
as protocols on how to use it, especially even in endodontics on my patients. So
And what's the benefit? What's the benefit to the patient?
How about almost no pain and no swelling?
Oh,
But you're going to come to the dentist, and the first question is this going to hurt? They want, is it going to hurt? No, I want to make it better so it doesn't hurt. And it's before I even touch them or before I do anything, I just hit them with the red light, or I hit them with the 1050 wavelength if I have to go deeper. And there's a protocol you follow as far as the lymphatics go, where you have to increase circulation, submandibular. Right. For those professionals out there, there's a certain protocol we have to follow first to help with circulation, and then we help with inflammation. And at the higher level, we help with pain control. So a lot of them their pain is reduced to the point where they go like, well, do I still need treatment? They question because their pain is gone. And I go, no, this is just temporary. You have an active infection. We got to take care of that and everything like that. So it's patient satisfaction. So they go out and tell everybody, how great it is. Everybody has a fear of root canals, and all of a sudden they don't have fear anymore. They say that they say it's that's hurt less than getting my teeth cleaned. So that's the best compliment you can get. So you make them feel better. You take away their pain. You reduce their swelling, and then healing is dramatically accelerated.
Yeah.
So I bring them back, for a couple days post-op, just for 10 minutes, just to apply, the therapy to them, the light therapy, and when they say I have no more pain at all, they're dismissed. Right. Now I'm anxious to see how healing takes place. So I'm going to bring them back. I've only had the units about three months. Actually, I have two. I will be getting a third, probably tonight or tomorrow. I'll be ordering a third.
Well, we'll get you the extra discount there.
I'm gonna get a third. I have somebody who is actually my attorney friend, who has a temporalis tendonitis, which is the muscle on a temporalis muscle is here. It attaches to what's called the coronoid process on the mandible. And he has pain on opening, he has pain when he touches. And he went for a consult to an oral surgeon who wants to do a surgical procedure on him. And I said, time out. Before you do that, I'm going to go over there, hopefully Thursday, and I'm going to give him his first treatment on Thursday. But what happens is, whoever I use it, they go like, I got to get one of these units. I got to get something. So it's because results are the best. Demonstration and results are the best. Mm-hmm. You watch the testimonials and they're great, but the people who actually are doing them are the happiest, because mm-hmm. they got the reward. They got the results.
Yep. And my landlord, I'll just interrupt here for a sec. My landlord, they bought units, and then their friends bought units, and I ended up doing a home delivery of two of the units to them, and the one their friend Judy she's looking at the sheet that I give out that explains all the different uses of the light, and she says, dental pain. She says, this can help on dental pain. And I says, yeah. And she says, how does that work? I says, well, you just hold the light like this. And she held the light there, and I just said, just hold it there for a while and see how that goes, you know. And we were talking, and I think it was about 6-7 minutes. I wasn't timing it, but all of a sudden she says, I have no more pain. She says, I was going to take Tylenol because it was throbbing and I have no pain in there. And my landlord says, come on, Judy, you don't have to say anything like that. You know, like he was just like, this is not real. You know, she was just having fun. She says, no, my pain is gone. It was
And
great.
It's true. And but you have also made an attachment
Yes.
that fits on the front of the light.
Yep.
That allows me to pinpoint the area that I need to deliver the light to. So it doesn't have to go everywhere. So for example, on root canals, I could just direct it either right there.
One of these guys. So you just put that in front of the unit, you line it up and you switch it on, and you put in the wavelength that you want. And now that light comes out of that tip, as you can see, it's kind of hard. There you go.
Yeah.
You can see the light coming out of the tip. So that's able to go inside the mouth. Yeah, that works very well.
And people are some people are concerned about the light in their eyes, because in dental offices, we all have probably your curing light that was from, right? And our curing lights we always hold up like an orange filter in front when we use the curing light. So they're used to that. So when they see the red light, they go like, don't I need a shield or anything? So you were kind enough to send me a link to get glasses, cheap glasses. So I got some of those off Amazon, and I say, you don't need it, but if you want to, put on these glasses, and it's fun.
Yeah, and for those that are kind of wondering, hey, what about light in the eyes? As a matter of fact, if you close your eyes, a lot of people will sunbathe in Florida on the beaches, and there's no signs posted that says you're going to go blind if you sunbathe an hour or two. Well, we have the same power intensity as the light itself, as the sun itself. So we're no more power than the sun itself. But if you close your eyelids, you're scattering the light, so it's very, very safe. And because it's not laser based, you don't have a very sharp point of light that's going to go into the back of the retina and possibly burn the retina in the back. So as a matter of fact, I've got some seniors that have closed their eyes and used the red light, and they're starting to they've seen some improvement on their eyes. As a matter of fact, we had the last 3 webinars was with a Dr. Nazer, and she talks about light being used for the brain, and how that can help with concussions and brain improvements, and concussions, Parkinson's. There's a whole list of things. Anyways, she got one of my lights, and she was having some difficulty with the far vision, clarity in the far vision, and she says she's improved dramatically. She's a researcher at the University of Boston. So you know what? It's the red light spectrum is very, very safe to use, and I think now you've got the experience too, and we've got a number of dentists out there that are quite a number of dentists that are using our technology, and but there's also people that aren't in dentistry that are joined in from different parts of the world, even here tonight. And one thing is that they have pain and inflammation. Now, we talked about pain and inflammation around the around the oral area or in through here. But tell us a little more about your wife and Ellen.
Oh yes, this is I'm going to let her tell you herself. We'll put her in a spotlight, and she'll tell you what it was like prior to me getting the light. What stage she was in. All right.
I have many problems, one of which is osteoarthritis in my right hip. And I was not able to walk very well because I couldn't extend my leg at all to make the first step. I saw a sports medicine doctor. He gave me the complimentary cortisone shot, which took not much of the inflammation down. And then I had PRP,
two protein-rich plasma injections, which
Okay.
is sort of the latest state of the art, where they draw your own blood. Are you familiar with it, Tom?
Yeah, I've heard of. Yeah.
So they draw blood, your own blood. They put it in the centrifuge. They spin it for 10 minutes, and it separates the cells from the plasma. Then he draw the plasma, and he used a ultrasound guided needle to deliver the plasma right into the hip joint.
Right.
And that is supposed to, it's undifferentiated cells that are there, and it's supposed to start like making cartilage if it's a joint like that, or whatever is deficient in it. And Ellen had 2 of those shots about 6 weeks apart, and they helped somewhat, but she still couldn't walk without, she walked very little, and when she did, it was with a walker.
Yeah. At the beginning, I had to walk into his office with a cane, and I was holding on to the wall so that I wouldn't fall. That helped somewhat, but it really wasn't that great. I started with physical therapy, thinking that we needed to build up my muscles again. And the physical therapist came in and she gave me all of these things. Your sartorius muscle is out of whack. It's got inflammation in it. There's iliotibial band syndrome that I have, and besides the arthritis in the hip. So she did what she could for me, but it really wasn't very good. We took a break in the summer, and I found Lou's light, and that's why
I found your light, and I brought it. I said, Ellen, we're going to try this and see, how this helps you.
Within days, my leg that I was working on had absolutely no inflammation in it at all. I've not seen my leg look like that in a very long time.
I wish we had taken before and after pictures of even her leg, the size of it, the swelling. It's reduced by 25%. Mm-hmm. And that's why I had to buy my second unit, because I couldn't get my first one back.
I wonder who stole it.
You're never getting it back. I have too many things I'm working on.
That's right. So I got the second for my office. Now I'm going to get a third. So, and then I'll get a fourth. I'll probably be, you should make me a distributor here. I mean, once they try it, they get, I haven't had anything that I've done it on that has not had positive results. There has to be something that doesn't work on. I just don't know what it is.
Well, we've circulated the light all the way around our household quite a bit, and I've my son and daughters are using it, and their mates are using it now. The kids are using it. The grandkids are using it. For different things, and I'm going to show some slides, but one of my granddaughter at 3 years old, she was in the kitchen with my son-in-law, and he had just finished pouring boiling water into the bowl for her to mix the Jell-O, and for whatever reason she decided she was going to pull the bowl closer to herself, and the bowl flipped, pouring the boiling water down her leg. And a really nasty burns. They went to the hospital, but they got some antibiotic cream. But when they got back, I immediately raced one of my big light panels over there to use on the large area that was burned, and that turned off the pain right away. That's amazing how that works. And then not only that, she healed up, and I'll show the slide in a little bit here, but she not only healed up, but there was no scarring in the end, but she healed up extremely fast. I had somebody from Israel who works with burns, and he saw the pictures, and he was just elated with what he saw with the light and how fast it helps speed up the healing. It's really something else.
Yeah, I mean, I don't know if I can even get my hand where you can see it, but let me see my camera. It's in the wrong spot.
There we go.
Not like I had scraped it like 4 days ago, and it was all raw. It was started to scab over. That's the way it looks now, 4 days after with the light. So,
Yeah.
Four
Yep.
days, and I'm 75. I don't heal like I'm 15.
Yeah.
I'm 75. My normal healing is slow. I mean, you just slow down as you get older.
Yeah.
Your healing.
Well, we've seen diabetic foot ulcers, which I'll show some video pictures of
Yeah.
too, and where they were going to amputate, and we've been able to save the leg from being amputated. So, well, Ellen, is there something else you'd like to share about your success?
Just,
Well, Dr. Mel Birchman was kind enough to do a Zoom with Ellen and I for about an hour, and because he's very well knowledgeable, he's been using it for since the '90s, late '90s, I believe, hasn't he?
Yeah, he's teaching around. He teaches around the world how to use light therapy for in dentistry.
All things.
Yeah,
and well,
yeah, all things.
All things. So took care of his wife, when she came down, when she got ill, and he had to treat her. And he's very knowledgeable in the whole body, and he spent a lot of time. He's got the GMA laser education, and I have to give him a plug and thank you. And he spent a lot of time, and he told us how to use it, where to use it. He helped explain about the 4 joules per centimeter squared versus 8 joules per centimeter squared,
right?
For the whether you want to take care of inflammation or pain control. So,
right. And that's something I do get into on some of the information, and I will again. But yeah, and depth there's a number of factors that one has to work into those equations. But yeah,
right. And once you learn, it's not that difficult. Once you understand it, and the other thing I think we should mention, that you don't spend hours treating with the light.
No,
you spend more like minutes in different areas. It doesn't take long to get results.
Yeah.
And I think that's something that you need. It would work quicker than if you took 2 Tylenol for Tylenol to work. It takes longer than the light takes to work.
Yeah, I do it 3 times a day, and at first I thought, oh my goodness, I'm not going to have time to do anything else. But it's very fast.
Very fast.
Yeah.
So,
well, it's I would like you to stay on board here and if there's questions out there, we're gonna in the latter half of our program here, we're gonna have Dr. Seiden ask any specific questions directed to him, and I will be involved in that. But in the meantime, we're gonna do our commercial and a few other things here about our light technology. So. Temporarily, I'm going to say we'll just sign you out for a moment, or not sign
okay.
out. Just turn off the video there. There we go. Okay. So with the lights, I wanted to also show as a follow-on to our 3 webinars that we did over the last 3 weeks. We talked about light penetrating the brain and how much difference it can make on the brain, and especially when it comes to the concussions and a number of different brain issues can be helped with the helmet that I have. And so what I'd like to do is right now play a video of the Tyson. And Tyson was he had smacked his head while playing a game in the church, and had hit his head really hard onto the concrete, and at the exact same time a kid fell on top of his head, so he ended up getting quite the concussion. So we will play this. We got the audio okay, so here we go. Hi, Rose.
Hi.
Tyson.
Hello.
So, Tyson, what happened?
Well, I went to like a cadet group, so it's like kind of like you learn skills and stuff, and I fell and hit my head. I got a really bad concussion, so I couldn't really do anything. I couldn't read. If I stood up for too long, I'd get a really bad headache. And we were trying different things like oils and stuff like that. And then my mom's friend recommended this, the red light therapy,
Yeah.
and so we went over here and we tried it, and straight away I felt results after it was done. My headache cleared up like quite a bit, and that day I was able to pick up a book and read, when before I couldn't even read a sentence. I'd get a really
And
bad
when
headache.
did this happen?
Happened I think last week Friday.
Okay,
No,
last week.
he does. It was Thursday that
Thursday, last
so it was a
week,
week
Thursday.
ago.
A week
So
ago Thursday.
Yeah,
And-
and he had like severe memory loss. He still doesn't remember
Yeah.
that day at all.
Right?
So I don't know if he'll gain that memory back. But we took him to Mac, and they did a CT scan and that, because he was continuously asking the same questions, like, what happened? Why does my head hurt? And like, it was on a reel, like probably every couple of minutes we tell him what happened. He's like, oh, that would be why my head hurts. I don't remember going to cadets.
Yeah.
And then he would ask it all over again, like, how come my head hurts? So like he probably did it hundreds of times. So they did a CT scan and they didn't see anything on the
That's
CT
at
scan.
McMaster University.
Yeah, at McMaster.
Yeah, yeah.
And then he's got to follow up with a neurologist in a few weeks because it was that bad. But
Right.
he's
Did you
like-
have any double vision?
No, not that I remember of that day.
But you couldn't read a book and
No.
you couldn't watch a video or
No, he had to be in a
I
dark
could,
room.
I had to really lie down. If I stood up and tried to move around, I'd get a bad headache. I tried reading a book. I got, I think, a sentence, and then I got a split and a headache again. So
Okay.
Because he really likes reading, so he was hoping to, because he was bored. He gets bored because he was lying around in a dark room listening to audiobooks. But yeah, the minute he started reading it, just
Okay. And so you did a light treatment under the helmet,
yeah,
and that was 1 minute of the bright red and 3 minutes.
of like the one you can't see.
Right, that's the near infrared.
Yeah,
And so 1 minute and 3 minutes, so 4 minutes of treatment.
and it was amazing. Like after the 4 minutes, I could tell straight away my headache was gone. I just overall felt better.
yeah. So you were still tired and stuff. You
Yeah.
didn't read yesterday yet, did you?
No, I didn't read yesterday.
Oh, you didn't read on the day you got the red light
Yeah.
therapy. Yesterday you started reading.
Yeah, I tried it, and I'm like, hey, I can easily read. I don't get a headache at all.
Well, we
And-
could tell a difference because he was really subdued. Like he's been really, like just hanging out in his room, really quiet and not.
Right.
And now he's like, whoop. So I'm like,
Oh, that is
he-
excellent.
He's definitely back in that sense.
And we're going to do just one more final treatment
I'm
here,
gonna do
probably.
another one, yeah, because
And just to make sure that things are covered. But
yeah.
Yeah.
well, thank you very much for being on our video,
Yeah.
Tyson, and really neat how we were able to see this. This is going to tell a lot of people what light therapy can do.
Oh, he's
Yeah.
very grateful. Yeah, we were very, very blessed and pleased that we found this.
Yeah.
Yeah.
Okay, all the best. Bye for now.
Thank
Yeah.
you.
Okay, well, now it wasn't that a fantastic response from one day not being able to read till even a sentence to the following day being able to read a book. He's a real avid book reader and was able to do that. So now I'll just show you some of the technology around here that we have. And I'm just going to move that around here. And this is the helmet here. And I'll just show you that this helmet has the lights in there, the palm lights. And so there's the 660 nanometer light right now. And what if I put my hand in the middle, it's just a nice warmth. And this is the 810 nanometer, the other wavelength. You can kind of see it in the, it's a little bit hard to see. But this helmet just has the stand. This is for clinical use. And this is what we've used for 1 minute of the red, the bright red that you just saw, and 10 minutes of the, 3 minutes of the near infrared. And we've had profound success, as you could see, with not only that individual, but there's been a number of other individuals who've had concussions or strokes or other issues with the brain. And more recently, we went to an autism conference in Texas, and I got to say, I don't have any experience on autism. And in this particular case, there's a couple of young boys that tried the light, And basically, parents reported back to me just that it seemed to have a calming effect for them. There's a number of research, but not a lot of research with autism, but there's some papers out there that are talking about what it can do for different types of brain issues. And we have this is our mini canopy, this device here, and it has the 2 wavelengths as well. Now you can't see it very well. This just goes and you can raise and lower it on top of, like, so you can flatten it right out and put it on top of a bed and adjust it very easily. But you can just basically see the 810 nanometer just slightly there. And that's the 810. And of course, the bright red is the 660 nanometer. And that's the 2 wavelengths from this device. Special order is something that we can offer 1050 nanometer, but there's a long delay at this point for that because of the special nature and the high cost of the 1050 nanometer LEDs. So we have the different lineup of lights. We have the professional, which has the 2 wavelengths, the 660 and the 810 nanometer. You can basically just see that in the window there or in the camera. This is the ultimate, which is the device that has basically 25% more optical power. You can see it going right through my hand. And there's the 810 nanometer as well. So it's that way it's similar, just that it has more so-called horsepower, in this case, optical power. And then we have the 1050 nanometer light, which has the 660 nanometer light and the 1050 nanometer. Now, the 1050 nanometer, this camera, you can actually see the purplish dots, which is the 1050. And the one red light, is just an indicator so people know that this is actually functioning. And but the 1050, you can definitely feel the energy coming from this device, and we have quite a bit of optical power coming from it. So I'm going to so those are the 3 units. So we have the professional that's running at 975. The ultimate is 1300, and the Super Palm 1050 with a 1050 nanometer wavelength, that's the one, $1,900. So with those units, I will honor a 10% discount. We got a winter special we're going to carry for just a little longer, tonight at least. And so if you'd like to go to SunPowerLED.com, and you can choose between the 3 units. I'll go into that a little bit further in the webinar here. But that's the 3 units that have had all sorts of success. As a matter of fact, the units that Dr. Seiden is using is the Super Palm 1050, and I believe he's and he's using the optical probe, which is something that can be ordered separately. It comes with it when you order it, and that allows you to put the light inside the mouth onto areas that you want to treat. So those are our different units, and I just explain a little bit. Well, actually, we'll go into the webinar now. The webinar, the slideshow. And if we could go to the first slide, please. Okay, next slide, please. Okay, this is my granddaughter. You can see the burns in the left-hand side. That's day 0. And later on in the evening, I was able to get one of the mini canopies ready for them, and they started the treatment on a daily basis. And that was this was 3 times a day, and basically there was no painkillers required or any type of thing to she didn't feel pain after the light was being used, and that happens very, very quickly with burns. It's very interesting. So you can see by day 6 the scabs are all there nicely over the whole area, and there was second and some little spots of 3rd-degree burns on that leg. And day 8, you see that all the scabs have fallen off. And I wished I had the picture of 1 month later where the scabs are not the discoloration was so little it was hard to see. And then at the 2-year mark, you saw that there's absolutely no scars. But I'll just say on day 8, if you look towards the knee, this identifies that you have a granddaughter. Somebody was drawing with a pen on her knee. So that's not a adverse reaction to using the light. That is a pen on the knee. So anyways, let's go to the next slide, please. So here's another picture of a really bad burn on a hand, and very, very quickly, you can see that the hand has dramatically improved in a quick response. And so next slide, please. This is a hand, and you can see by nasty burns, no grafting was done, but by 5 weeks, that hand was all beautiful. So very fast use. And so we are looking at this light being able to be used in the war zone in Israel for civilians and for soldiers. So we have an organization called Rays of Hope for Israel. If people want to donate to help some of these people that have severe burns and from the war, we can help some of these kids and other adults that have had injuries. Next slide, please. This is, I've actually been involved with light therapy going back 15 years ago. So I developed a product, many versions of it, and we were using this in Haiti in 2010 when the earthquake occurred. What happened was a lot of women, at least women who were in the kitchen at the time of the earthquake, the propane stove pulled away from the wall because of the vibration or the earth shaking, and it tore the gas line and released the propane gas. Now, propane is very heavy, so it stayed close to the floor, and then the pilot light would ignite the gas, and there'd be a flame front on the floor. So women had severe, a lot of problems with burns on their legs, and we were able to use the light and basically turn off the pain for these injuries of burns, all different kinds of burns. Next slide, please. So this is, you know, you saw the other building, but here's, you can just see everything was just shattered around there, and we were working in MASH tents. This was an early version of a different type of light that I made. It was prototype, and I used special water filtering, and we brought out technology basically in the shape of a hairdryer to treat with light therapy. Next slide, please. This is Dr. Praveen Irani. He's out of University of Buffalo. He was head of World Association of Light Therapy. And he, in his lab, they were able to see why you could accelerate burn wound healing. And it has to do with latent TGF beta. And he's got a research study on that. But there's not just this one study, but there's lots of studies showing how burns and wounds can be speeded up in healing. Next slide, please. I've got some couple growth slides coming up here. So if you're you might a little squeamish on this, you might want to look at something else for a minute or two. On the left is a young fellow that 19 that had swung a pickaxe, and when he swung it through some, it ended up being some soft dirt and ended up coming right back and with the momentum and hitting him right above the ankle and cutting his tendon right through. They attached the tendon, and then it fell apart again, and a couple of days, and then they did another surgery, which would mean a lot of trauma to the area. And you can see at 2 weeks that the stitches are there, but the inflammation is not bad. And in 3 weeks, there was already a great improvement. Now, they had told him that it would be 6 to 9 months before he'd be walking. Well, that's normal course of treatment when you have some kind of injury like this with tendon cuts and damage. But let's go to the next slide, please. On the left-hand side, we'll just show you how he was able to, at 3 weeks, get movement. Go ahead. And whoops, there we go. And although he doesn't have a lot of up and down movement, he's already got movement there, and and there's not a huge amount of swelling there. The swelling was reduced. And if you look at 4 weeks, it's not 6 to 9 months, but at 4 weeks, he's walking. Let's go for it. Still needs to continue to improve his gait. If you want to play that again but he's walking. So all the problems with muscle atrophy, what was done was that the light was done three times a day, sometimes more, but they cut the cast in such a way so that the cast could be removed and put back on. And then every time they needed to do a light treatment, they took the cast off and did the light treatment on the area. And that would be like a 10, 15, 20-minute treatment each time over the area. Next slide, please. This is a diabetic ulcer that had gone gangrenous, and they were going to cut this senior woman's foot off. And the surgery was scheduled for 1 week later. The children, the adults, they got one of the lights into the hospital, and they started treating that area about 15, 20 minutes a day. And within the 1 week, the doctors decided not to amputate because everything looked improved, and just continued the light treatment, where 2 months later, there was just a small wound left to heal. And in 4 months, it was totally healed. Next slide, please. So here's a case of someone getting open heart surgery, and you can see in the other picture to your right that he was doing daily treatments with the light, and you can see how the wound or the surgery, the scar, there's no scarring there. Basically, it's healing up absolutely beautiful. Next slide. This is interesting. I'm sorry about the light shadowing in here, just the way the light was thrown, but if you probably can see where there's where they cut the vein out in his forearm, and you can see that it's very, very nicely healed. And yet his leg, that's his thigh, basically, where they removed the vein, it's still puckered, and it's still red, and it definitely wasn't as far as long. Well, he treated his arm every day, but he only treated his leg once a week. He decided that was what he was going to do to see, really how much difference would there be. Well, you can see here, after 4 weeks, it was a huge difference between the arm and his leg. Next slide, please. So we've seen this unit, the helmet that you saw for strokes. This is another young boy with a concussion. He was seeing double, and he had a patch over his eye at day 8, and he did one treatment, and 2 days later, he wasn't wearing the patch. He could see pretty decently, but he did say that he couldn't look at the far wall. He could look at it, but he couldn't quite the writing on the wall was kind of fuzzy. So on the far wall across the area, and he did the light therapy, and he came out after just doing 4 minutes, and he said, I can see that clearly now. And so just 4 minutes of light therapy on the brain, and it even changed helped his eyesight in just that short treatment right after that. The person on the left, he had a stroke, and he had a bad slur. This is 2 months after the stroke, and he did his first light therapy treatment, and you could not understand him on the phone. It was near impossible. And he did the one treatment, and we actually did 1 minute of the bright red and 4 minutes, 1 more minute to compensate for the color of his skin, dark skin. And the next day, his friends and everybody else could hear him speak clearly. So that's amazing what this can do on the brain. If you look at the right-hand side, that's our canopy light, and it treats the whole area of the back and neck in one shot, or wherever you position the light. and you can raise and lower it and control it and do all sorts of things. Next slide, please. So this was the concussion that you saw, and we'll go to the next slide. This is a young woman with a stroke, and she was able to, due to the limitation of time right now, we're just going to pass on this, but she had her hand was up near her neck. She could not straighten out her arm, and as soon as they try even a little bit, the muscles were so tight and pulling that she couldn't, without severe pain, she couldn't pull it much down. And in 20 minutes, she was able to pull her arm straight down to the side, and she was able to have better, no pain. That was the big thing. No pain across her back and in the neck area and everything. It was very, very painful coming in. And 20 minutes later, there's no pain across her back, and she was able to straighten out her arm and also her fingers, which were also curled in because of the stroke, because of the muscle control. Next slide, please. So this is our Super Palm 1050. As I mentioned, it's our most powerful device, as well as the wavelength. Next slide, please. One thing that we do is we have a very close LEDs. So we have a high density of high power LEDs, which means they overlap, and that allows for deeper penetration into the body. Competitors have their LEDs, they'll even put lenses on them, but they just don't penetrate because they don't have the power and they're not overlapping. So it's not a cumulative effect in the area. Can we switch back to my video, just full size video for me? Okay, so this is like one of the competitors, and you can see the spacing of the LEDs. So if I take so if I turn this unit on, let's do that. What you'll notice is that there's just dots of light there. So all the other space around the area is all space that is not lighting up. As a matter of fact, it's one of the other wavelengths, but you can see that it's missing big spots there, okay, in this picture. And with our device, I'm just going to shut this off. We have a continuous amount of optical power, just like this kind of the intensity that you saw there, but there's no missing spots. So we have full intensity over the whole area, and it's very, very even. So this here, even as I bring it back further, you can see that it's very, very even illumination with a high amount of energy density. And that includes when you're doing the 1050, you can't see it, but same thing as far as the power density. Back to the full. There we go. So next slide, please. Okay, here's an example of what happens when you're talking two different wavelengths. On the left, you see 660 nanometer, and the right is 810. And one of the things we do also is we don't use half of the LEDs are 660 and half of them 810. And so you really get half of the power of one wavelength and half of the other power of the other wavelength. That's so they can cheap out and say that they got a certain power level, which even then they don't have. A lot of Chinese specifications out here, but we have full power on the 660, and then you select it for the 810, and it's all 810 nanometer wavelength for the whole area. So that's why we have, and you can see on the left-hand slide, the 660 nanometer is going through my cheek. But with the 810, you can see it not only going through my cheek, but also through the gum line as well. Next slide, please. This gives you an example of our three different units. We have the Palm Pro on the left-hand side, and it has the 660 810 nanometer. This is a relative chart, so you can get some kind of idea of what's happening. You can see with this is what would happen as far as the amount of energy that's getting deeper into the tissues. And so if you're looking at the ultimate, which is our middle unit. That's the $1,300 unit. It has 25% more optical power than the professional. And then when it comes to the Super Palm, the very far right-hand side, I drew it black because black is invisible to the eye. As you can see, there's that eye, the eye on the very bottom, and your eye can see wavelengths between 400 and 700 nanometer, and you'll see it even up to 800 nanometer. You'll see light, but it's going to be pretty dim at that point. And beyond 800 nanometer, it's going to be invisible. But what happens is the difference between the 810 and the 1050 is that you can actually get deeper, a little deeper penetration because of the 1050 nanometer. So next slide, please. This is an example of when it comes to the difference between laser and LEDs. And more recently, we were able to show that even in this older slide, these two, the laser pen and the LED, were both set to the same power level of 3 milliwatts. And so you can see my finger on the left-hand side, the light going through it, it's diffused in all directions. And that's from an LED. But guess what? When you talk of a laser, here's a laser on the right-hand side. It's diffused in all directions as well as soon as it goes through the tissue. And as a matter of fact, there's next to no difference between the light coming through my finger, and we can measure that light. And it turns out whether it's coming from a 3 milliwatt LED source or whether it's coming from a 3 milliwatt laser, highly focused laser, it's the same light penetration. But that's only with 3 milliwatts. And then if you go up to power levels like we have on our devices, where we're putting 5,000 milliwatts out of light or 8,000 milliwatts of light, we have a high power density of anywhere from 100 milliwatts per square centimeter to 180 milliwatts on the different models. So next slide, please. Turns out that lasers are, as we mentioned this earlier in the program, lasers or the LEDs are very safe because it spreads the light over the whole area, as you can see in that picture with the LED light hitting the bottom of my finger. It's lighting up the whole area. Whereas if you're using a laser device, most laser devices, or at least light devices that compared to what we have, the laser is going to be 10 to 30 times more costly than our LED devices. And so, we have a lot of optical power, but we have a lot of safety because it's not a laser device and it doesn't have the high price tag to it, but still will accomplish the same task when you're comparing, let's say, a 5 watt laser compared to a 5 watt LED, one of our 5 watt LED devices. So it just gives you an idea that there's very little difference between the two, and you don't have to spend all that money for it. And then there's a lot of laser products that are much lower power. So you're not going to be spending $15,000 to $30,000, but it's basically a fraction of the optical power, the total optical power coming from our unit, especially when it comes to continuous wave lasers. So next slide. So it's been mentioned, Dr. Seiden had mentioned the temporalis muscle and how it can be treated. And this happens to be Dr. Jerry in the background. Some might recognize him. He does the laser LED courses. So, there's really great effects of using this for dental applications. Next slide, please. And of course, I have to try it out on myself. So I decided to fall and hit my head against concrete to test out my light. No, not really. I wasn't planning that. I busted out my front tooth. I had really damaged my lip inside. And even 4 days later, I was so much improved. And I don't know if you're looking if you're gonna look close enough at the video or your video screen, but I have no scars from any of that. but I do have a tooth filled in here, but you can't tell. So anyways, yeah, they couldn't save it because it was, I broke it off right at up into the root area. So there's no chance, unfortunately. Next slide, please. So it's FDA registered. There's a whole host of reasons why it's very, very beneficial, and the power that we have, and very lightweight to hold on to. There's no batteries to replace. You don't have to worry about batteries going down, and you basically can use this continuously. So that's one ideal thing. And as a matter of fact, if you travel, the nice thing is because it doesn't have any batteries, lithium batteries inside, you can put it in your carry-on luggage, and there's no problems with that. So next slide, please. The LEDs basically are good to like 50,000 hours, and the light output only reduces like 10%. And we have done things in our device. I've got patents on the different things, and I got a patent pending on this particular device on how I'm removing the heat so that this thing runs really, the LEDs themselves run really quite cool. The other thing is the large surface area that we have on here allows to get to a very large area. So you can treat a larger area pretty quickly. Next slide, please. Okay, there's the 3 different units. And then what you don't see is the Super Palm in here, but that's the one that's 1900. Next slide. And well, there's the Super Palm. And I think we're going to hold it off there because I know we got some questions. And I tell you what, anybody who wants to hang in there for the questions, we'd love you to stay, but you'll be still entered in the draw. So at this point, we're going to continue on with a whole host of questions. And I know one question that came up right off the bat, if we can ask Dr. Seiden to come back on with your video. There was a couple questions that had come up, and I want to ask you to. Oh, excellent, and very good. Can you hear us? Okay.
Hear you fine.
Okay, so one of the questions was how did you treat yourself, Ellen, with the light? What was your protocol that you did?
I started with my hip and used it in 3 places, in the front, on the side, and in the back. 10 minutes each on the high 1050,
Right.
and then 3 minutes each on the same areas for 3 minutes on the lower number.
On a red light.
Red light.
Yeah, 660.
And for the sartorius muscle, I went from my knee up across my thigh up to my hip. Did that for 5 minutes on 660.
Okay. Very good, very good. And you had a problem, so you couldn't walk with your you had to use a walker.
Yes.
Who was it? The physiotherapist that said something that
the physical therapist told me I would never be able to use a cane. I'd always have to be using the walker, and I'm using a cane and I'm working towards nothing.
Beautiful. Beautiful.
2.5 months.
Yes.
Just 2.5 months of treatment. So
yeah. The hip no longer has any pain except where the ITDS, the
iliotibial band.
Okay.
Where it attaches up
where it
there.
attaches, yes.
But it's not really the hip, it's sort of behind it.
Yeah.
But that's the only one place that I'm still working on very hard.
Okay.
But all the cracking and everything went away when I was walking.
It was a very noisy, she had a very noisy hip.
Okay.
You know, she'd feel all the cracking, like the arthritics that was going on there, and that's gone. That's gone.
Beautiful, beautiful. Okay, I'll answer a few of these other questions. Good to watch as I treat my plantar fasciitis with my 1050. Yeah, we've been able to see a number of people have that improved upon. As a matter of fact, we got a short video there from one of the politicians, and he was having a lot of pain. I met up with him, and he bought one of the lights, and he's a marathon runner, and he was able to see tremendous, total relief from that, and was able to run again. And as a matter of fact, he did extremely well in the marathon, the next marathon that he ran. And he was very concerned that he wouldn't be able to do any training or even run because he had so much pain. So Leslie said, I recently had my ACL replaced. How will the light help with the recovery process? Thank you, Leslie. Leslie, it just helps speed up the healing. So you'll be able to help that area heal much, much quicker. And the possibility of not having scar tissue is huge. And I've seen that many times. Yeah, and so we got another question here. Can your light reduce spine-related pain? Yes, we've been able to see that work very, very well for a lot of different back pain. Now, back issues, back pain. I had early on, I had an issue with when I had developed this light, I had a bulging disc, and it was 1.3 centimeters bulging out to the side, and I was in excruciating pain, and I was able to use the light. And they were talking about the only solution to this was using to get a surgery to correct that. And I used the light, and I also used the inversion table to try and help pull the muscles and get the muscles to pull apart. And within 6 months, I was doing much, much better. And within a year, I got another MRI and done. And with the MRI, it showed that the disc had totally healed. So it's possible to not have to do surgery. But if you do surgery on whatever, it'll really help speed up the healing. I know we're running over time here. Are you okay to stay on for a little bit longer, Dr. Seiden?
Yes, I am. I just want to ask you a quick question. One of the reasons I want to order like 3 more lights is I want to give the patient the light to take home.
Right.
So then I come back, keep it for a couple of days and then bring it back. You think they'll bring it back to me? I'm afraid they'll start using it on other parts of their body.
Yeah. Well, you take their credit card and you say, when you give it back, you give back your credit card.
Your credit card. Yeah, I may have to do that. The whole idea is you want to help people. So
yeah,
it would not be bad if they started using it, and then maybe they get their own. I don't know if they all need super palms, though. They might be able to, whatever they do it with just a regular palm.
Yeah, the ultimate or the professional. Yeah. And so the professional, I'll just mention here, the professional is a great device. Can it do things on the knees and ankles and shoulders and other, neck pain? Absolutely. But it's kind of like the more horsepower you have or the more optical power. It's like a car or a pickup truck. And if you fully load the pickup truck and you have a 4-cylinder pickup truck and you try and go up a big mountain, you may get there, but it's going to be harder to get there. But if you have a 6-cylinder, you're going to do better. If you have an 8-cylinder, you have no problem getting up there. Now, if you had a 12-cylinder, now you're really moving. That's the type of product we have. We have the 8-cylinder and 12-cylinder. And I think there's many 4-cylinder, 2-cylinders, and 1-cylinders out there that they sell on Amazon, and it just does not compare at all.
You don't want them to be disappointed, in the results either. So that's, well, I want to know, they'll be asking me which unit should I get. So you have to guide them a little bit.
Yeah. Yeah. So the professional is more shallow. The ultimate gives you more depth and faster. And then you go to the professional, the ultimate, and then you go to the super palm, and it gives you the extra edge. So, Anita, we mentioned about the protocol that Dr. Seiden's wife used, Ellen there. Emma, can you say which strength did you use for your granddaughter? Oh, I used the mini canopy. That's this one here. which is pretty much the same optical power as the professional, but it's 15 times the area that you're treating all at the same time. So there's huge benefit to having a larger unit. Now it has a price tag of $5,900 US, and so it's not something that to sneeze at, but it has the optical power over a large area, especially when it comes to treatment of large areas in a clinic. This and fast. The helmet here is 6,500, so it does the whole head at once. But a person can use the palm light directly and use it like 10 places over the whole head. Now it takes longer to do because you got more area to cover, but we've had good results helping with tinnitus and other issues, vertigo and other things like that. So Bruce is asking about, is there a protocol for lymph therapy? That is definitely, okay, there's a protocol for that. But what I'm going to suggest is if you want to contact me directly, we'll give you some other information. Also, as Dr. Seiden went to the course, I think the course is about $250 and through GMA lasers, and they get into extensive information on how to use it's an all-day course, how you use the light for the lymphatic system. That's really important to help drain the lymphatic system. The lymphatic system is very much like a river flowing away from the area that is injured, and so you need the debris and the lymph fluid that flows to flow away from the area. So usually what you do is you don't unstop the top of the river, you make sure the bottom of the river where is leaving the body. You want to start with the lymph nodes there, and you work your way backwards to the lymph nodes back to where the injured area is. So when you finally open up all that and you get to the injured area, when the injured area is being treated, the lymphatic system is flowing. Joy writes, I love my Ultimate handheld. I do it for many different treatments on my body. I'm not always sure when to switch from the 660 or to the 810, which is best for the foot, knee, and neck, and mouth and back. Very good question. Thank you, Joy. Something that I missed in mentioning. So the 660 nanometer is the one that's very bright, okay? And the thing is, it doesn't penetrate as deep. And when you don't penetrate as deep, what it does do is it gets absorbed in the blood. And that's beautiful because with the blood, it helps the whole area because it's a systemic effect. So 660 is very beneficial that way to help the blood, but the 810 or the 1050 can penetrate a lot deeper. So if you're going to be treating real deep joints, I'm going to suggest, like you heard here, is that you want to spend much more time with the 810 or the 1050 for deep joints, with still some bright red for treat, because that's going to affect the blood, which is going to be carried through the area as well. So a much shorter time. Now, if one was treating their fingers is not very deep. So in that case, you would treat, let's say, 1 minute of the bright red and 1 minute of the near infrared. So, you can do that much faster. When it comes to the brain work, we're finding we just try and stay more on the lower end of treatment, where we treat 1 minute of red and 3 minutes of near infrared on the area that you're trying to treat. So you treat 10 places around the head. If you have the time, then you can, and if you do it more often, the helmet just does the ability to treat the whole area in 4 minutes, the whole brain. So that's very beneficial to speed things up. But with tinnitus, We've seen now, right now, I'm looking at around 9 out of 10, 9 out of 12 people. And I'm waiting to hear from the 13th person, because I think we're going to add another person to the success list, where they've been able to reduce their tinnitus, and it's been pretty neat. So that's not everybody, and all this stuff that we're saying here. We do have a disclaimer, and I have to say, I don't know anything. I'm not a doctor. Run to your doctor to ask him what you should do. But in the meantime, you could listen to a couple things that we might suggest here that'll help you get better. So, so was the light therapy protocol? This is from Bruce. Protocol in the heart surgery patient. What was the light therapy protocol? So he was basically treating. He just went all out. I told him to treat short. Like he could treat those areas for within 10 minutes, like 5 minutes on an area kind of thing. And he'd watch TV, and he says, I think I'd use it sometimes for over an hour over the area. That was not a problem. Oops, okay, we're just getting back here. Dr. Gordana, welcome tonight as well. Carla, did you move the light in a sweeping motion as you treated? You can. It's also, if you find the red light sometimes it will be absorbed closer to the skin, so it'll feel much warmer. So you can put that light, we've designed it in such a way that you can put it right against the skin. There's still airflow, and it keeps it nice so that you don't overheat. But if you find that maybe because you have poor blood circulation that is running warmer than, or that you would like, then, yeah, you can move it around and treat 1 minute here, 1 minute there, 1 minute here, 1 minute there, that kind of thing. You don't have to move it, but you can move it, but you want to cover the area. So, Dr. Gordana, I'm interested, is there any info on using the red light for root canal and cavitations as well for gingivitis? So that's where, as you pointed out, Dr. Jerry Ross's course, and they're together, Dr. Jerry Ross, Dr. Melvin Birchman. That's an excellent course to learn a lot. So
and their introductory course is only like $97.
Oh, all right, okay. I think they must have added that more recently.
Yeah, and then what their 7-hour course is like $497, but their
all right.
introductory course. And also, I should mention that if you buy a unit from you, that's the instructions. One of the instructions you can get is the protocol from Dr. Ross.
Yeah, so. And yeah, exactly. And I will say that on our website, if you go over to SunPowerLED, you go all the way over to more on the top line, drop down to resources, go into resources, and on the resources page, you'll find one of the things is PBM findings. There's 7,700 research articles there on light therapy. So this is not something that's brand new. It's been around for a while, but now we're getting even more light. That's more light power, which can even improve the abilities of some of these things that you're trying to treat. Power density is extremely important, and I was trying to point that out. I know we're running along in time here. I'll try and answer a few more questions, and I think we're going to have to call it quits shortly. But I will answer a few more here. So my mother is due for a knee replacement in 1 month. Do you think this technology might eliminate the need for surgery? I can't say. Everybody's different, but I can tell you that two things. One is if you're using the light ahead of time, the surgeon that's going to do that knee replacement is going to have a whole lot easier time to fix that knee. To do whatever surgery he needs. And my own brother, he's very, very muscular. And one of the problems is when somebody's extremely muscular, and there's so much pain, their muscles have contracted so much that they can't pull things apart to put the knee parts in. And so they have to actually start cutting muscles and things to loosen up the area. And he's extremely strong. And the doctor was kind of surprised, the surgeon was quite surprised that he didn't have to do anything like that. Guess what? He was using my light therapy like 2 weeks before and loosening all those muscles, and his pain reduced. Now, why didn't he find results from the light before that? Because he wouldn't listen to his brother. I told him, I told him, come on, you know, start using the, I don't know. The doctor says I got to replace both knees, and, you know, and so, you know, no, it can't help. I've got so much pain down there. Well, it was only until after he had the, before the knee surgery, and then after, and how fast he healed. And now guess what, Tom, that works for this and it works for that. And I used it for this and it helps with that, but he wasn't listening. So it does not work if you don't use it. It also doesn't work if you park it in the closet after you buy it, or you put it on the night table and don't bring it out. You have to be using it. You brush your teeth every day, use the light every day, you know, protocol.
So actually, I should also mention that my first exposure to the light was through one of my dentist colleagues.
Oh,
who's also a customer of yours, Dr. Bruce Silver.
Oh, okay. He's on tonight.
He is.
Yeah.
Oh, hi, Bruce. So yes, he was the one. He's the one who introduced me to it initially. Yes, and then it was a matter of going online and doing some research, and next thing you know, I was a happy customer.
Yeah.
Well,
I gotta say, Dr. Silver there, thank you very much for getting it and spreading the word, and I don't know how hard a case you were to convince that you needed to look into this, but how hard were you, or you believed him pretty quickly?
I believe him. He's a very reliable source. He's very technically oriented. He's I don't want to say, you know, he gets every gadget, but he has a lot of state-of-the-art stuff, and he's my source. You know, if he says it's good, you know.
Okay.
So
I got Dr. Lauren Duke online too, from California. Dr. Duke has bought quite a number of lights off me and helped a lot of her patients. And my doctor, who did knee injections with PRP and exomes, said to not use light therapy for a few months. He does not want the material to dissipate quickly. What do you think? I'm sorry. I'll just leave it at that, because I mean, I have a patent lawyer in Israel, and there's so much knowledge as to how this speeds up the proper healing. You're giving every cell the right stuff to work with. So when they're working with these other compounds and things that are done, it starts putting them all together properly. It's just like giving them the right building blocks. Why wouldn't you give them the right building blocks to help this? And I would, so many times, doesn't have to be a only PBM treatment. This can be used in a combination with other treatments. So the one surgeon in Israel, he was going to loan one of my lights to my patent lawyer, and the patent lawyer said, okay, I'll try it. And then he checked with his doctor, and his doctor said, don't do anything. I forget what kind of surgery on his elbow. I think it was his elbow. He said, don't use that light therapy until after it's fully healed. Like, it's mind-boggling that they do not understand this. And that's the problem, is they haven't done the research. They haven't looked into it. What do you have to say to that?
it works. I mean, it works. I don't see any downside to it. I mean, there's no, you can't hurt yourself.
Yeah, it's giving the cells what they want to do.
Right. It's either
what they need to
increasing the blood flow or reducing inflammation and pain. You
Yeah.
know, I mean, when you take an Advil, you're reducing inflammation, you're inhibiting, prostaglandin release and the whole cascade. And that's the whole way it works. But you got to wait like what, half hour for it to start. You get almost like instant change. People feel it right away.
Yeah.
It works so much faster.
Wow, I'm going to only answer a couple more of these questions because it's just going on and on and on. I can't, and I see you're looking at your watch there.
No, I just got a text message from Dr. Silver.
Oh, oh, that's very good, very good. So
I'm good
Grace,
time wise. Yeah, no, I'm good. I'm good time wise.
yeah. So Grace is asking, how long do I use which? I think she's saying which wavelength and which case for how long. I'm going to say you want to use both wavelengths almost all the time. It's just that you use, if it's shallow, you use a lot less of the deep light, and you can save a lot of time that way. And if it's shallow, you're going to use less time as well for the red. But when it comes to deep sections, you want to use a lot more of the near infrared. So you're looking at using the near infrared, whether it's the 810 or 1050, to a lot more. So I would say 75% of the time you're going to use it for deep sections. And, for deeper areas, you're going to use the near infrared and some red. Use them both, okay? Okay, both wavelengths. Don't, they complement each other. Dr. Gordana is asking, I'm interested in using the red light for caries. Now, I don't have any experience. Can you tell me anything about, what do you think? Or
Myself, I don't think it'll work because caries are caused by bacteria. And so you got to tell me, does the red light or the infrared, does that affect bacteria?
Yeah, so blue light is I don't have a blue light version, but I will say out there that the blue is going to be the strongest hit against bacteria. But red definitely can reduce bacteria and clean up. I had a fellow that had 60 years of an infection in the bone by his ear, and they had done multiple surgeries to try and clean the area out, and he lost a skull and some of the upper bone in that area. And he goes to my church, and I suggested he use the light on his ear in that area, and in 2 weeks it all oozed out, and he says, I cannot believe it, the pain is gone, and it was already majorly healed in that area. So the 60
I don't know,
years.
but that may have been because of increased circulation, as
Yeah.
opposed to killing an increased circulation. If you get the body's own defenses,
Correct.
in that area, then they'll fight the infection better. But in a tooth, we don't have that. The circulation's not there. You have a hard tooth structure, and it's being softened up, decalcified by the bacteria. So I don't, you don't have a blood supply that you can increase. I don't know. I have my doubts whether
yeah.
I
don't know. I don't know. I'm gonna have to pose the question out there. I'll try and find out. So this is interesting. I got Mr. William Campbell on the line. He's an airplane driver. And for those that don't know what an airplane driver is, he told me that that's also, they call them airplane pilots. So he says he's had some really neat improvements for his wife in her situation, but he says, hey, William, it's great to be able to connect with you. And he says, I use the 660 first to increase blood flow, and then 810 nanometer for treatment, followed again with 660 moving blood again. He's done a lot of research. Don't kid yourself. It doesn't matter what area of life, if you can do research and dig into the red light therapy and learn, you know, he taught how to fly airplanes. So from the sky, he wasn't on the ground. So I think some of that was on the ground too, but anyways, somebody can learn like that and learn quickly. That's great. So anyways, Beth writes, hi Beth. Beth likes our lights too. Thank you. Last time I looked, I thought it was geared toward dentists. I'll check it out. Okay, so yeah, so there's a lot more. As a matter of fact, if you go over on the website and go over to the right-hand side and go down to past videos, we have Dr. Jerry Ross on, we have Dr. Mel Birchman, we have also Dr. Terrence Baker, now we have Dr. Seiden, and we have, you know, a lot of good videos there. We have Dr. Praveen Irani. We've had a number of different doctors on and researchers, and the knowledge is in that light can affect a lot of different things. So I want to thank you for taking the time tonight to share your story about how this has helped you and Ellen, and
Yes.
thank you so much for lining up the time for sharing this, because people need to know how light can, you know, and it's not just any light. You're not going to get this working for you with a flashlight, okay? You need some serious light power coming from the medical devices that we've developed here, and you're going to get results. But you start playing with some of the other things, and you can try and try and try, and you're not going to get the results. So with the question and answers, if there's other questions that you have, please go and send us an email at info@SunPowerLED, and we'll try and answer those questions as well. Please visit our website, SunPowerLED, and do what Dr. Seiden has done, and others that have joined us tonight, is buy some of our units, get using them, find out how well they work, tell others about it, help your neighbors and friends, your family, your seniors. My mom is 92 years old, and she's using the light every day for all sorts of arthritis issues, and she's been able to get around with, she had a really, really bad fall about, what would that have been, a few months ago. And I immediately got her the big light here, and she started using that. At first she says, how am I going to use this? I don't know, you know, like, and she knew how to use the palm light. And I says, look, Mom, just you move this over here. This moves up and down. Next, you know, she's a pro at using that light. And my brother actually lives right beside her. And so he says that he's seen a few times in the middle of the night, the whole house is glowing red because she's using it at 3 o'clock in the morning. But from that bad fall, she was able to recover after having her back severely jarred from the fall. And so it's really helped her. But I want to thank everyone for joining us tonight. And I wish you all of the God's richest blessings in your lives. And hopefully you can learn about this light and how it can help you. So thank you again for everybody who joined us tonight.
Thank you very much.
All right. Bye for now.
Good night.